Welcome to another edition of TechQuest Today. My name is Kelly Lewis, and I'm President and CEO of TechQuest Pennsylvania. And we're really pleased to be here today to talk about the Pennsylvania Health Information Exchange, which is one of the initiatives of TechQuest Pennsylvania to bring together healthcare organizations, buyers of healthcare, and work on putting information technology throughout this industry to connect hospitals and physicians and health insurers all into a vibrant network that shares securely information to increase patient safety and healthcare quality. Our first guest today comes to us from Capital Blue Cross, Kent Whiting, who's very involved in their IT operations at Capital Blue Cross, but he's also been very instrumental in TechQuest Pennsylvania, and he's chairman of our board of advisors and also an advisory board member of the Pennsylvania Health Information Exchange. Very vibrant volunteer, Kent Whiting. Kent, welcome.
Thank you, Kelly. It's good to be here.
Kent, you've been with us from the very beginnings of this effort, and I wanted to, thank you for your many hours of efforts to help get these technologies moving forward and bringing together so many organizations in e-prescription efforts, radiology efforts, and now HIE efforts, Health Information Exchange. But tell us a little bit about Capital Blue Cross, and we've seen a few commercials about your recent anniversary, but tell us a little bit about Capital Blue Cross.
Sure, I'm happy to do it. Capital Blue Cross is about a 1 million member health plan located in central Pennsylvania in the Lehigh Valley. As you mentioned, we've got an anniversary going here of 70 years of service in our community. We're very community oriented, very community focused, want to do anything that we can to improve the health and the vitality of our community, and we are dedicated to that task.
So for almost 3 years now, we've been focused on ways to bang the drum, I like to say, on e-prescription, electronic prescriptions, and getting that between physicians and pharmacies and health insurance companies. And Capital was out of the gate with a solution. Tell us a little bit about the Capital Blue Cross e-prescription efforts.
Sure, I'm happy to do it. We are partnering with a company called Primatics Incorporated, and what they do is they provide a full end-to-end service for e-prescribing. A lot of times physicians would only get hardware and software to do e-prescribing, and all the workflow and integration was left to them. In this case, Primatics provides an end-to-end solution with broadband, with going in and analyzing workflow, with understanding what the challenges are in that particular physician's office, and getting that physician up and operational with a handheld device to do e-prescribing. We're very happy with our work with Primatics up to this point.
So I'm not an expert on all this, but I'm a big cheerleader for it. I've seen doctors' handwriting, and they used to scribble on a little pad, and you'd take that to the pharmacy. Tell me a little bit about what e-prescription does to replace that scribble.
Okay. Well, a physician in the office would have a handheld device, and in that device all their patients for the day would be listed. So if you came in and you wanted to have an exam and there was a prescription needed, the physician would look your name up on the device, would find the correct medication for you, and then that would automatically be transmitted to the pharmacy of your choice, where you would then go pick it up. No handwriting issues involved at all.
Well, that sounds like a huge improvement for patient safety, because the pharmacy could misread they'd have to call for sure to confirm what the scribble meant and that type of thing.
Right. This has eliminated a lot of back and forth between physician offices and pharmacies around what did you really mean here, and is this correct, and is this the right medication for my patient, as well as also doing drug interaction checking live in the doctor's office so that that physician can advise that patient if there's a drug interaction problem.
Great. Now, is this some pipe dream, or is it happening right now? Where is this in Pennsylvania?
Okay, well, it's not a pipe dream. Nearly 500 physicians now have this technology operating in their offices, and about 800 have signed up for this technology, and continue to roll out in the neighborhood of, let's say, 25 to 40 a month with the physicians in the area. The goal being to try to get into the 1,000 to 1,500 range.
I mean, that's super. It sounds like it's right out of the gate and already has some adoption. I mean, I'm sure some physicians must be really liking this this capability?
Yeah, the thing the physicians like is it's integrated to their workflow. The other thing is, because we're working cooperatively with Primatics, they don't really have to pay for this technology, so they get the technology to use and benefit their patients without paying anything.
So it's free for the physician, it saves lives, and reduces a lot of medical errors. It just sounds like a home run, so it's exciting.
Absolutely. It's been very good for us and very good for our physician community and our members.
Now I know, and the viewers might not appreciate, but you also recently went through getting a white paper written on the exchange of data between hospitals, and you're working on your master's? Or so
yeah, my master's, just completed my master's actually about a year ago at Penn State Harrisburg in MSIS, Management Information Systems. And the focus of my thesis was really inspired by the work that's being done by TechQuest, the Health Information Exchange, was talking about radiology exchange and how can we move things around from radiology image in a report perspective and provide that information real time to the physicians that need it.
And this is something that we've been very focused on at the Pennsylvania Health Information Exchange. Getting so you don't have to run around to chase down CAT scans, and also to enable an emergency room to have all the possible medical history at the fingertips of the emergency room. What are some reasons why this isn't done now? It's always been confusing to me.
Well, I think it is more of a socialization of the idea and making sure each of the entities are comfortable around exchanging these types of records. It's not so much a technology challenge. The technology is actually there to do this. It's more of how do we work among organizations, such as what we're trying to do with the Health Information Exchange.
So we just went out on the street. We did a RFP for a HIE consultant, Health Information Exchange consultant, to try and connect Harrisburg hospitals and Capital Blue Cross and Highmark and insurers, and give that information, exchange that information, and hopefully possibly even lower some costs in this. What are some of your thoughts on the HIE effort?
Okay. The HIE effort, would encompass the exchange of pharmacy, radiology, probably lab data, and then building from there could, be the full electronic medical record. There's great potential here. Trying to reduce things like a duplicate lab, performing duplicate lab tests, performing duplicate imaging studies, having that information available at the time the physician needs it to make the clinical decisions that they need to make could have a dramatic impact on healthcare costs in the future.
And I know in some of your research and some other companies have provided some estimations of what goes on just in the greater Harrisburg area. But something like $20 million could be duplicate studies. Now some of them might be necessary, medically necessary, but even if 10 or 20% of that number is millions of dollars that could possibly be saved. And also it would save a ton of time.
Right. Time and money, not just the duplication of the test, but let's say that a person was seeing a physician and that information was needed immediately to make the correct clinical diagnosis or to avoid doing something they really shouldn't do. They could avoid maybe complications down the line with that person. That could have a dramatic impact on the overall healthcare dollar spend.
So I'm excited to work with you on this because I think there's savings as we get the HIE up and running. And I know we were talking with Dr. Turndrip at Hershey Medical Center, and he's the head of the ER there, the emergency room, and getting that information to their fingertips is going to be such a value. So any observations on that emergency room interface there?
Sure. I mean, in the emergency room, you're dealing a lot of times with critical situations, life and death situations. And if you don't have those records available, if you have to take the time to then have that study redone or redo a test or something, that could mean minutes or time that would save a life. And so having that stuff available really at their fingertips is essential to the emergency medicine setting.
Great. Kent, thank you again for appearing on TechQuest Today, and also for all your efforts with TechQuest Pennsylvania and the Pennsylvania Health Information Exchange, and also to all the employees at Capital Blue Cross. Just thank you, because you've been such a strong proponent of all these technologies.
Well, I really appreciate the invitation. If you couldn't tell, it's something I'm very passionate about myself, and that our company feels strongly that we should support. So thanks very much for inviting me.
Kent, thanks, and to our viewers, we'll be back after a brief message. Thank you.